Hello everyone, I'm Mark Elisur Dipula Singh from BSN 1C, and today I'm going to perform the head-to-toe assessment. Right now, I will do my vital signs on my patient, which will be the temperature, respirations, blood pressure, and O2 saturation, which are all within normal limits. So just by looking at my patient, his skin color is even and appropriate for his ethnicity. His facial features are symmetric and he doesn't show any signs of distress. I'm going to start from the head all the way down. His hair looks good. No lumps, lesions, or infestations. The shape is normal cephalic. Just by looking at my patient, I can tell that his pupils are equal and round. So I'm gonna flash a light in your eyes, so just look at my nose. And they both react to light. I'm going to have you follow this to your nose. And they accommodate bilaterally. So next, I'm just gonna kind of pull down your eyelid. His conjunctiva is pink and his sclera is white. Next that I'm going to check is the ears. I'm going to take a look inside his ears. Good. There is no redness or drainage in his ears. For the nose, I'm going to make my patient tilt his head up and I'm going to take a look inside his nose. His nose has no drainage, no redness, and no signs of the Wisted symptoms. I'm gonna have you pull one nostril and breathe. Next, I'm going to check his mouth. I'm going to make my patient open his mouth and I'm going to check it. His mucous membrane are pink and moist. His teeth are intact and his uvula rises and falls midline. Next is his neck. I'm going to test his range of motion. I'm gonna make my patient hold up and down, left and right. So patient does have full range of motion with his cervical spine. Next, I'm gonna assess his carotid arteries or hear his crowded pulses. Good. And he has +2 bilaterally. Next that I'm going to check is his chest area. So this is going to be the patient's lungs and heart sounds. So I'm gonna go ahead and listen to your front side and your back side. Lung sounds bilaterally are clearer, and his anterior and posterior chest has no adventitious sound were noted. Next, I'm going to listen to your heart sound. So, S1 and S2 were regular. No extra hard times, no murmurs were noted on exam. Next that I'm going to assess is the patient's skin. His skin is warm. No tenting is present. No lumps, lesions, scars. No tattoos. Her radial pulse is +2 bilaterally, and capillary refill is less than 3 seconds. And by just looking at his nails, it is short, round, and clean. Next, we're gonna go ahead and listen to your apical pulse for 1 minute. Patient's apical pulse rate was 86 and regular. Next, I'm going to inspect the patient's abdomen. Just by looking at my patient, I can tell that his contour is flat, his umbilicus is midline, his skin is constant throughout the whole area. Now, I'm gonna go ahead and locate all your 4 quadrants. And patient does have active bowel sound in all 4 quadrants. So next, I'm gonna go ahead and push around on the different areas on the patient's stomach. Please let me know if you feel pain or anything. Patient reports no tenderness on palpation. Next, I'm gonna check for the pedal pulse in his feet. It is +2 bilaterally. Next is the posterior tibial pulse. It is +2 bilaterally. I'll go ahead and lift up the patient's knees to check if there is any edema at all. There is no edema present bilaterally on lower extremities. I will gonna check the patient's muscle strength. So that's all for the head to toe nursing assessment. Thank you and God bless.